So we get our vaccine supply from the federal government through an allocation through the state of Minnesota. So we find out about a week ahead of time how many vaccines we're going to get to use for the following week's clinics.
We're operating about 3 days a week right now. There's at least 2 weeks of planning that goes into every single clinic.
In public health, I am the family health program manager. And for incident command response, I'm the operations chief.
As a safety officer, one of my key responsibilities is to make sure that the public and also our staff and also all city employees are safe during the operations of these vaccination clinics.
My role within vaccine operations is actually the planning chief, and so I do the planning ahead of time of a clinic, and so I get basically a clinic ready to go on paper.
I'm actually a paid-on-call volunteer firefighter here for the city of Bloomington, and due to me having an EMT, I was invited to volunteer and help out with the vaccine clinics here.
I need to gather information from planning about the location and the site plan, how we're going to operate. Then I need to hear from logistics on our staffing, supplies, things like how many vaccines do we have. I also need to do a lot of math, and I need to count how many first and second doses are due this week. And then we put it all together and we have to come up with a strategy to make it happen.
So when you look at the state dashboard, you can see we're doing almost 100% of our vaccine in 3 days. That's a phenomenal amount of work on our staff's end, where we process hundreds of doses and get them out the door in under 72 hours.
After vaccinating 200 plus people within the past couple of vaccine clinics, I would say that most of the people that I've had have been absolutely delighted to actually be able to participate and have the vaccine. I think the most excited ones have been teachers, and they're just looking forward to working with the kids again and feeling safe to be around the kids.
What we've been learning with the clinics is that what might work on Monday isn't always going to work on Wednesday.
Every single clinic is different. Even though you might be in the same location, we have different staff, we have different people visiting the clinic, and every day is a new day.
And each time we do the vaccination clinic, we learn something new. So this time we went back through and we checked what our traffic flow was. We actually reset up the entire clinic so that we have our registration area in one place as opposed to where it was last week. And we're just trying to make the flow so that it's comfortable for everyone, and also so that we can keep everybody safe.
So as of February 10th, we've been able to vaccinate over 1,800 individuals with their first dose, and a little over 300 have gotten their second dose. So we're working through a list of dentists, optometrists, mental health professionals, personal care attendants that are working on the front lines, taking care of people in our community that are not able to telework.
I really would like everybody to understand that we want everybody who's interested in getting a vaccine to receive a vaccine. The supply does not meet the demand right now. So as we learn how to distribute and how the supply is coming in, we're building our capacity to meet the need.
We are really dedicated to doing an equitable distribution of this vaccine based on the MDH guidelines and the priority populations that they have outlined for us.
We literally have dozens of staff working across the 3 cities we serve, Bloomington, Oneida, Richfield, that are working incredible amounts of hours to get this done.
I think it's very important for the public to know that while it may come off as the vaccine clinic is doing very well and it looks like it's really super easy and it shouldn't be a big deal, it's very important to make sure that people know that there's a lot of work that goes in behind the scenes to making the vaccine clinics work and function the way that they do.
Honestly, the only thing I kind of want the people to know is that being patient is a great thing to be doing right now. I know that a lot of people want to have the vaccine done, and it's not possible. It's just we don't have the dosage to actually provide to everybody. So be patient, and thank you for being patient.